My name is Petra Oliva. I'm coming from Archimed Life, which is a medical laboratory based in Vienna, specializing in rare disease diagnostics and niche diagnostics. But my training, training is biochemistry. I have a PhD in biochemistry, and I spent about 16 years working in pharmaceutical field, developing therapies for the rare diseases and rare disease patients. And I also spent some time on a diagnostic program. So MLD is the genetic disorder which is caused by deficiency of ARSA, which is arylsulfatase A enzyme, causing accumulation of sulfatides in the different tissues in the body, causing different clinical presentation. Mostly it's a degradation of CNS, it's a demyelination, and it's affecting the developmental milestones and CNS of the patients. There is a treatment currently available within Europe and European countries. It's a gene replacement therapy, which is available in a specialized treatment centers approved within European countries, and there is a plan to bring the therapy for the United States as well. So there are four forms of MLD, and especially the ones which are late infantile, early juvenile forms are very aggressive, which affecting the CNS and PNS and developmental part of the kids. When the kids are born, there are no clinical presentation, and it takes a certain time, but then it starts with very rapid decline when the progression of disease is significant, and there is of course no possibility of back. Now, the importance of the newborn screening is with the fact that sooner you start with the treatment, the better outcome for the kids before they will start experience a clinical presentation of the disease. And especially for the certain forms of the MLD, which is the late infantile, early juvenile form, it can be very rapid and very aggressive forms. It is important to identify those kids before the first clinical presentations appears. So the newborn screening program, it's actually the only program which can identify the babies on time before the clinical presentation starts in order to initiate the treatment. So we have implemented a pilot study within Germany, so in collaboration with the screening center in Hanover, Germany, which is covering the north part of the German, where the MLD was implemented as a pilot program on the regular newborn screening panel. So then when the parents are coming for the newborn screening sample collection, they are being asked if they would like to participate in this pilot study. And MLD was put in as a pilot. We will get the sample for the testing. The newborn screening is starting as a tier testing with the sulfatides. This is the biomarker accumulated within the body and tissues as a first tier screen. The samples with elevated levels of sulfatides would be tested then for enzymatic deficiency, for ARSA, all from the dry blood spot, and of course the genetic confirmation follows. The genetic confirmation has the differential diagnosis for PSAP and MSD, multiple sulfatides deficiency as well. We have submitted the ethical committee approval in summer 2021. And up to date, the study was initiated shortly after it has been approved and started in fall 2021. And up to date, we have screened over 140,000 babies within the German region. And we have identified 4 babies positive for MLD. The benefit of the study, and that's why it's a prospective study, is that we also work closely in collaboration with the treatment center in Germany, Tübingen, and the babies are being referred to the treatment center and follow up with the benefit of treatment. Now, with these results, there is also preparation for the GBA submission to make the MLD as the mandatory screening for the babies within the German region. With the success of this study, we also have additional countries participating now into the program as well. For example, Austria joined the program just this summer 2023. We have already screened over 18,000 samples from Austria as well. You know, our study is maybe the first largest study for the newborn screening on MLD as a pilot study. But there is many other studies currently ongoing in different countries, including UK, including France, Italy, and there is really great collaboration effort within all of the screening centers to also implement the screening and MLD as one of the disease on the panel, with the discussion of implementation of the assay, the simplification of the assay, and then just having a success story to around the world.